seem to have some difficulty with the audio, so that I can't hear what you're saying, but I believe that you can hear what I'm saying. If there's any questions you have, if you're having difficulties, then please use the chat, and Anita, who is our coordinator, will be able to contact me. So thank you for finding time to come. This is just a brief introduction. So I hope to speak for about half an hour on special care dentistry in Ethiopia. I was hoping that I would be with you in person and working with my colleagues at the Dental Association. But of course, with COVID and the restrictions on travel, plus also other issues going on in Ethiopia, this has not been possible. So it's a webinar, I'm afraid, which is a poor substitute, and I hope this year to come to Ethiopia and meet with you. I want to say thank you to our sponsors of our charity, Colgate-Palmolive and Henry Schein, of the charity, the Global Child Dental Fund, and we want to particularly thank the Boa Foundation that has supported and funded this project in Ethiopia. My name is Raman Bedi. I'm Emeritus Professor at King's College London, and I'm the Chairman of the Global Child Dental Fund. And this project has only been possible with colleagues in Ethiopia, the Dental Association, and the university colleagues as well. So I want to say thank you and acknowledge their contribution. So why are we doing this project on special care in Ethiopia? The Global Child Dental Fund has been undertaking training opportunities in special care dentistry in countries where the more formal teaching of the subject has been sparse. So we have done similar projects in Zambia, we've done in East Africa. We are about to complete a project in Cambodia and in India, and we will start this week in another project in Indonesia. The aim is to develop the issues of special care. Now, we are not out to develop a textbook on special care dentistry. That's not the aim of this project. The aim of this project is to make an introduction to the subject and to allow that subject matter to go to general practitioners, nurses, medical nurses, and doctors. And the aim of it is to give that introduction and use that as a basis for developing, which we hope will happen over the years, people who will want to become specialists in the subject and provide the specialist care for this population. So who are we? Well, the Global Child Dental Fund started in 2006. I was the Chief Dental Officer for England, and I became, and one of the results of that is that the UK government called for a Global Child Dental Health Task Force. And the task force was to help promote children in, to help children who are particularly disadvantaged, and especially in low-income countries, to undertake this activity. So a declaration on child oral health was produced, and we, sorry, I'll turn my phone off, and we launched the project in 2006. So this became the basis of a declaration on child oral health, and it was the beginnings of my involvement as the director of the program. What have we done over the years? Well, the main thing we've done is that we have tried to work with the senior dental leaders of the dental profession around the world. These have been deans of dental schools, presidents of dental associations, and dental officers. The project is once a year for a week, and then during the rest of the year, I work with those individuals to develop programs in their own country on how to improve child oral health. This program now has been running for 14 years and it's won numerous awards. After the first year, Harvard University became a partner, and so we have an academic partnership of Harvard University, King's College London. The charity sits in the middle, and then we have two of the largest dental companies in the world, Colgate-Palmolive and Henry Schein. And this public-private partnership has endured for over 14 years, and we have now over 210 alumni, people who have attended our leadership program. So this leadership program builds on the fact is that dentistry will change when our senior dental leaders actually begin to work together and actually start to promote more programs in their own country. And they work in a network and with our partners, which are outlined below. On our website, you can see the history of our programs, particularly the Senior Dental Leadership Program, and how it is beginning to have a major impact in the oral health of children. The alumni are spread out. I'm sorry to say that we have no one from Ethiopia and very few from the north part of Africa, but actually every year we have several candidates coming from African countries. We did have a delegate, of course we did, Emmanuel, who came from Ethiopia. So in the lockdown period, what have we been doing is we've not been able to travel, but we have undertaken 3 major projects while we've had all the travel restrictions of the last few months. We've undertaken a translation and the production of a number of booklets in different languages that relate to mother and child oral health. We've continued to work in Zambia. We've been working there for about 3 to 4 years, and we have funded the refurbishment of the Lusaka Dental School to build a pediatric dental unit for the children there. And I'm pleased to say that the equipment has now arrived. We imported some special pediatric dental chairs, and I hope later on this year, if restrictions are lifted, to travel to Zambia and Lusaka and to formally open the centre. This is the old dental school, it's not the new one. And then, of course, we've been working with colleagues from East Africa and to develop a special care dentistry booklet for Africa, which is widely used in a number of countries throughout Africa, which is free of charge, and it's to be sent to all dental students and dental professionals. But that was the beginning of our project, and of course, as we've launched the program, it was in English, but actually it became quite clear to us that we needed to translate this and make it more relevant for each country. So the first African country that we were able to work with was Ethiopia, and we were able to translate this to Amharic and also to reflect changes in Ethiopian traditions. I mentioned the Zambia project already. That's a long-standing program of ours, and this is the new dental chair which we purchased, a pediatric chair, and for a number of years I've been going to help train some of the students in that country in care for children. These are the educational programs that have been translated into a number of countries and have been given free of charge. Essentially, it's oral health care in pregnancy, oral health care for toddlers and babies, and then of young infants. And this was the booklet, which is in English, being translated. But what I want to do today is just to walk you through quickly the Ethiopian translation, which I hope you will have access to. We have posted and is being shipped 2,000 hard copies to be sent to the Dental Association, who we believe will distribute them to their members and to other health professionals. But of course, it's also online and readily available through that format. So the introduction is there, and you can see that the committee that was established for East Africa to make sure that we were putting the right information and, of course, reflecting traditions in Africa and some of the challenges that you face. And that was the introduction that we have. When we translated the Ethiopian version, it was, of course, working with the Dental Association and our SDL alumni present in Ethiopia. So special care dentistry is very broad brush. It can mean many things to many people, but certainly in any country, older populations, the more seniors among us, are one that we should pay special attention to. So older people, as the booklet will explain, have challenges in themselves. They have mobility issues. They often have drier mouths. And of course, many will have missing teeth and have aesthetics and function problems in eating and communicating. So in some countries in Europe and in North America, there's a specialty of geriodontics, people who specialize in providing care for seniors. But of course, we recognize that in many countries, this is not possible. But I think every practitioner should be aware of some of the challenges that older populations present. Dementia is certainly one of them. And dementia is a challenging condition that dentists face. Of course, memory loss, there can be speech issues, confusion, personality change, and of course that leads often to neglect and difficulty with daily tasks like toothbrushing and just hygiene in general. The WHO tells us that dementia is increasing in our global population. It affects every population, and particularly in countries that have a higher proportion of older people, this has become a major problem. And of course, dentistry and providing dental care is a challenge. So the booklet there highlights the issues around dementia and how dentists could begin to provide care for people with that condition. Physical disability is always challenging, and mobility, and we need to be careful when there are populations. With people in wheelchairs and in difficulties, actually getting people into the dental chair is very, very difficult. With a physical disability, you have to be very careful. You can't just lift patients and put them in the dental chair so that you can do treatment, because they often have challenges with spine and other conditions. So you have to be very careful in hoisting people with physical disability. And there are special chairs that can help you to move the whole wheelchair into a supine situation, and how you can then provide more appropriate care, because it's very difficult to do anything while a person is in a wheelchair. It's very difficult to use hand instruments or with high-speed drills when people are in that situation. So all the data over a period of time has showed us that people with physical and also learning disability often have a high number of missing teeth as opposed to their counterparts, because dentists find it very difficult to restore. So the M in the DMFT is usually much reduced, and the missing component is much higher, because dentists find it easier if a person has a problem to extract a tooth rather than to fill the tooth. Stroke is a growing problem, and it's something that we should all be aware of. And it's not so much the stroke, but it's the long-term effect of rehabilitation. It leaves people obviously with mobility issues, poor speech, and difficulties in their recovery. So we should all be aware of how to manage stroke, and how we deal with the rehabilitation phase of people with stroke. Of course, cerebral palsy is a challenge, and we need to be aware of managing the uncontrolled body movements that people have, the balance problems, and of course, how to manage if the patient goes into seizures. So cerebral palsy is particularly difficult, but of course, one of the most important things with cerebral palsy is how to help the patient to keep their teeth clean. So oral hygiene is very, very important, and so often they need assistance, and we have to teach their carers how to actually clean the patient's teeth, and that in itself is quite difficult. But it's an upsetting condition where you can get uncontrollably drooling, hyperactivity, and it's very, very challenging to provide dental care. But the most important thing for all these conditions is prevention. If you can prevent the cavity or prevent the dental disease developing, then that's going to be the most important thing you can do. There are a number of medical conditions that I'm sure you're aware of that we need to be aware of, that there are dental implications with regard to it. Epilepsy is there, and we need to know the impact of medication, and of course, how well controlled the seizures are with epilepsy. So the booklet highlights the challenge that we face with people with epilepsy, and we have to remember that epilepsy is a range. There are some people that are very well controlled, and other people who have uncontrolled seizures in both frequency and severity. So we have to be alert to the condition, and if they're on medication, that this medication can have a major impact on oral health issues. So, for example, with some of the medications, they get an overgrowth of their gingiva, which becomes unsightly and also difficult to clean, and you end up with bleeding, etc., with relation to it. Diabetes in some populations are very, very common. India, for example, has a very high level of diabetes, both type 1 and type 2. And but we need to be aware of patients that come to us with diabetes. The diabetes will have a number of dental implications. Well, if it's uncontrolled, then it's going to be difficult in the dental chair with fainting and other activities. But of course, we have to also be aware that uncontrolled diabetes can have a major effect on the dental tissues, particularly the bone, and periodontal disease is far more advanced in uncontrolled diabetes. So we need to be aware how diabetes is managed, working with our medical colleagues, and then, of course, being careful when we provide dental care. Asthma is a major problem, as is the heart failure, and in asthma we have to be careful with patients who may have difficulty with breathing, and particularly if they're uncontrolled, and then just to have the right equipment and be aware of the type of limitations in the care that we provide. But usually in well-controlled asthma cases, dental care should be just in a routine way. Dentists should always be aware of cardiac problems that may arise in the dental surgery, and of course, to be aware about any type of heart failure. The signs being the pain in the chest and in the arms, breathlessness, sweating, and nausea. We've introduced the infant oral mutilation. Now, all the traditional textbooks on special care do not include this, but we thought it was very relevant for East African countries to recognize IOM as a major public health issue. Now, we did this because we wanted to highlight it, but in every sense, it is a difficulty of special care dentistry. So young children, usually below 1 year old or certainly below 18 months, have their primary canine tooth germs removed. This is without local anesthetic. They are just held down and restrained, and then the primary canines are just extracted, usually with some sharp instrument. It's not difficult to do the procedure, but it's fairly traumatic for the child. And of course, there's always a number of fatalities as a result of this. There's also a recent publication that shows that the long-term effects on the adjacent teeth can be considerable. So in a recent study in Israel, where a number of Ethiopian children and Somali children had migrated to, they were able to follow up children who had IOM into their teens. And they found that a number of lateral incisors and canines had become non-vital, and there was other problems. So we have to be, it's not just the trauma of a young age, but it's also something that can happen over a period of time. So IOM is a major issue for the Global Child Dental Fund, and we have an End IOM program to eliminate the practice in all over the world, but particularly in East African countries. We made a commitment to meet in Addis Ababa every year to have the chief dental officers from the East African countries to highlight the progress they're making and also the activities they're undertaking to end IOM. Learning disabilities is always one of the more traditional subject areas for special care dentistry. And this is a population where, again, prevention is essential. Many of these children will not be able to tolerate traditional dental care, and we have to ensure that the prevention is at the foremost. Brushing teeth is very, very difficult with children with learning disability, but we have to show carers how best they can do that. But also many children with learning disabilities are given sugar in the form of candy and sweets as a treat. And so they invariably end up with some problems, and we have to be careful with the diets that this population undertake. Autism is not learning disability, but autism is separate, but it has many of the challenges we have in providing dental care for learning disabilities. Autism isn't a condition, it's a range of situations. You have some autistic children that are very, on one end of the spectrum, are able to do most things in a traditional way. And there are others that are much more severely impacted on and are challenging in every way. So autism is basically, it's a condition where a real introversion of the child. They can be extremely intelligent, very high performing, and but they have characteristics like having repeated behavior. So that if you're providing dental care for autistic children, you should try to remember the procedures, how you treated the child, what the room looked like, the type of things that you did. Autistic children respond to repetition, repeat behavior. They remember what you did and they expect the same to be done. Then they're also very difficult because they have a lot of uncontrolled movements. And autistic children, like all the learning disabilities, the children of having more traditional dental care, for many of them, is very, very difficult. They're hyperactive, they have sudden moods and behavior changes, and of course they're very prone to accident because of this uncontrolled movement can lead to trauma, especially to the upper incisors. Again, Down syndrome is not a learning disability, but it falls into that spectrum. And these children have very traditional facial features and body features as well. And they also have particularly oral health considerations you need to behave. Of course, we've mentioned, like many other special care, behavior and the willingness to accept traditional type of treatment. But with Down syndrome, you also have situations of missing teeth you have to be aware of, and then how to provide care. The one message I want to leave with you is that children with special care deserve special attention, but also to remember that they will have often complex medical problems as well, and the care provided for them should be integrated. You should be in contact with the medical practitioner and to make sure that the dental and the medical care is integrated and that you're aware and they're aware of the type of procedures that you're doing and how best to do that. Let me just say again that this booklet is not a textbook on special care dentistry. We have targeted countries where special care dentistry has not been developed, in the sense that in many of the countries we work, there is no national dental organization that focuses on special care. So, for example, in the UK, we have the British Society for Disability and Oral Health. We also have targeted countries where there is a sparse number of specialists in special care dentistry. So with that in mind, this booklet is really an introduction just to some of the key issues about special care and some of the conditions that are traditionally considered in that subject area. And it's aimed at dental students, dentists, medical nurses, and doctors to make sure they're aware that these children do require particular attention and also require specialist care if it's available. So I hope that's going to be helpful for you. I hope that in all the countries we work in, there will be a development of individuals who will specialize, who will actually take extra training and be able to take a leadership role in making sure that the children of the country, and particularly those with special care needs, have that specialist care. So I want to say thank you very much to our foundation for helping us to do this project, but of course to all the colleagues in Ethiopia, particularly the Dental Association, that has helped us put this booklet together. And we hope that in years to come, we may be able to expand it further, to put more content in, and that will help develop the expertise of our general dental practitioners when they provide this care. We hope and believe that in the future, people might want to take specialist training in the area and come back and develop the specialty of special care dentistry for Ethiopia. Thank you very much. Okay, I've used my allocated time, and I wondered if there's some questions that people have. We have recorded this webinar, and so we will make that available for people. And that would be helpful for anyone who wants to see that again. And of course, we're available for